Vitamin D. Now, this is a two-part series about vitamin D. In part one, I will focus upon how vitamin D may help to reduce our physical risk for upper respiratory infections. It will address using this important nutrient to help protect us physically during the pandemic of COVID-19. Use of this nutrient may be very helpful because COVID-19 is an upper respiratory infection. For clarity, please understand that I am not an endocrinologist, nor do I have any interest in selling vitamin D. I have not done a formal study on vitamin D and COVID-19. I do believe that would be a very good research option. I have come across some information from an otolaryngologist that may help protect us, especially my African American friends and family. This is my summary and attempt at translation of a 32-minute presentation called Vitamin D and the Respiratory Tract. I will reference that source of information and allow you to research his supporting studies and the research papers that he presents at the end of the video. Please also understand that I am licensed to serve or minister in both my pastoral and my medical ministries. I have worked in medicine for over 30 years. I have battled with upper respiratory infections as both a respiratory therapist and as a licensed provider specializing in otolaryngology, ear, nose, and throat, and as a father and as a patient. Recently, as I studied for my medical ministry, I happened upon some information relevant both to my pastoral and my medical concerns for friends and family who are facing the risk of COVID-19. I am also a pastor for more than 30 years. As a student of the words, I saw analogies in the physical impact of vitamin D as a metaphor for an important response in our mental and psychological fight with the COVID-19 pandemic. Please tune in to part 2 for those pastoral insights on vitamin D and our mental health and our well-being in this time of great risk and great loss. Sunlight was used to treat tuberculosis. The early doctors and scientists found that when patients had more sunlight, they actually had a reduction in the severity of tuberculosis. The vitamin D was the cause of this reduction. Upper respiratory tract infections seem to be worse in people who have a vitamin D deficiency. Skin initiates vitamin D production. The sun exposure is the primary source of vitamin D for most people. Solar ultraviolet light stimulates the production of vitamin D3 from dehydrocholesterol in the epidermis of the skin. Skin produces it, then the liver converts it via hydroxylation into ergocalciferol, which is vitamin D2. The final stage of production has been historically noted to be through the activation in the kidney, but now we know that the nasal mucosal lining is also able to produce 125 vitamin D, otherwise known as cholecalciferol or vitamin D3. Now, not a lot comes through food. Most of it comes to our system via sunlight, if we get sun. Recognize that wintertime, for those of us who are north of the 37th parallel, there's not enough sunlight to produce vitamin D3. The 37th parallel runs south of San Francisco, Colorado, St. Louis, and Richmond, Virginia. For those who live north of any of those areas, you don't get any vitamin D from the sun during the wintertime. Guess what? Flu season follows sun season. What do I mean? Low sunlight equals high flu rates. The COVID has been worse in the African American people. African Americans tend to have low amounts of vitamin D. That's right. Now, why? Because of our protected melanin. That melanin slows the production of vitamin D when we're in the sun, and as most people I know, we typically avoid the sun. So African Americans tend to have lower vitamin D, and that might be why African Americans are having a worse problem with the COVID-19. Remember, COVID-19 has also been worse in New York City than it has been in sunny California. Recognize that the rickets epidemic was treated with cod liver oil and sunlight. Yeah, they recognized that those children who were playing in the low city lights were having more problems with kids than their parents had when they were playing in the sunlight. So the impact of low vitamin D was noted, and they began to treat the children with, again, cod liver oil and get them out in the sun, and the rickets epidemic was controlled. And that's why they supplement milk with vitamin D, and many other foods have vitamin D to keep rickets under control. But recognize that it doesn't take a very high level of vitamin D to prevent rickets. Every cell in your body has a vitamin D receptor. Every cell in your body has the ability to do a genetic response to the presence of vitamin D. Most people often describe vitamin D more as a hormone than as a vitamin. The sinus mucosal tissue, the tissue in your nasal lining, has the ability to create vitamin D. It utilizes something called 25-hydroxy-D1-alpha hydroxylase. That's an enzyme which converts the inactive vitamin D, otherwise known as ergocalciferol, into its active brother, vitamin D3, cholecalciferol. Now, nasal tissue can activate the vitamin D into vitamin 3 because it helps to protect your body. One effect of vitamin D3 is that it reduces the inflammatory process by reducing the amount of IL-5, which is a cytokine. Cytokines, remember, cyto means cell, kine means kinetic action. So cytokine means something that makes the cell's response. So by reducing the amount of that, it reduces the amount of inflammation and may be helping to reduce the cytokine storm. Now, you may remember cytokine storms have been noted to be a contributing factor to the deaths of many of the great people who have died due to COVID-19. A cytokine storm is when the body is fighting so hard it actually begins to destroy its own tissue, trying to kill off the virus. The cytokine storm is a result of an out-of-control inflammatory process. Vitamin D helps to reduce that inflammation. Vitamin D also causes the production of cathelicidin. This is the only antimicrobial protein that humans make. It is an antiviral, an antifungal, and an antibacterial. This peptide or protein can punch holes in the cell membrane of the foreign invaders. So how do you increase cathelicidin? Supplementation with vitamin D increases cathelicidin and increases the activated macrophage production of cathelicidin. Macrophages are part of the body's defense against invaders. The therapeutic potential of vitamin D and others against infection remains yet unexplored, have not been studied in depth yet. But vitamin D interacts directly with the white blood cells of your immune system. What would I do? I would supplement with vitamin D. I got tested as soon as I possibly could. I would recommend you ask your doctor about a 25-hydroxy vitamin D total assay. I'll say it again, 25-hydroxy vitamin D total assay. This is done via a 1 cc SST tube. The standard treatment goals for vitamin D are 2,000 units a day. The testing labs report less than 20 nanograms per milliliter is low, but endocrinologists state 40 to 60 nanograms per milliliter is enough to balance the PTH production. Again, endocrinologists who are specialists in this field recommend 40 to 60 nanograms per milliliter. If you are deficient, you must fill the tank. And that means 50,000 units of D3 once per week times 8 weeks per his recommendation. Then his process would be to prescribe 3,000 units daily and recheck in 3 months. Summary: vitamin D deficiency has been noted to increase the amount of upper respiratory infections. COVID-19 is a virus that attacks through the upper respiratory tract. Note that influenza infections decrease during the sun season. More vitamin D is produced when we are out in the sun. Increasing your intake of vitamin D may help your body protect you from COVID-19. Remember, the test for COVID-19 collects a sample from the nasopharyngeal region, the back of the nose. That is the area we're trying to supplement with vitamin D. Vitamin D replacement reduces upper respiratory tract infections. So, I suggest you consider daily or weekly replacements if you're less than 10 nanograms per milliliter. But remember, endocrinologists recommend 40 to 60 nanograms per milliliter. Monthly boluses of vitamin D have not been shown to be effective. So, check your levels, talk to your doctor, supplement if your levels are low, talk to your provider about the best process, but also be careful because too much of anything can hurt you. Greater than 100 nanograms per milliliter is known as toxic. Please remember, these are ideas and suggestions. Your health is your decision. I am not your doctor or your medical provider. Some people in the test groups with adequate vitamin D still got sick, but less frequently, and they had less severity. You should still wear your mask, but vitamin D may help you on the inside of your mask. Your health is your decision, and your process is your decision. I'm an African American in the over 60 age group. I am also working to reduce and control my blood pressure. Tune in to part 2 for more on that process. I am successfully making dietary adjustments to avoid diabetes and excessive weight. I suggest you consider doing the same. I am also in 5 of the 8 high-risk groups for low vitamin D. I am elderly. I am African American. I am a son of the Bissa tribe from Burkina Faso. As a black person, I will need 4 to 6 times more sun than a non-melanin person. My BMI is greater than 30, so I will need 2 to 5 times more vitamin D than a smaller person. I live north of the 37th parallel. I am rarely in the sun, so I will begin spending more time in the sun and supplementing with vitamin D daily. I will recommend that my grandchildren get 1,000 units daily. I was tested this week, and my level of vitamin D was 25 nanograms per ml. I had been taking a multivitamin with 400 IU for over 6 months, so I ordered 50,000 units of vitamin D from Amazon the same day I got my results. I'm recommending that you consider checking your levels also, but please be aware that too much vitamin D, or anything, can be bad for you. The toxicity is greater than 100 nanograms per ml. You can do too much of anything. You can even drink too much water. In closing, I will quote Joshua, "As for me and my house, because I'm not in charge of yours, you are." God bless. Please click like and subscribe below. And tune in for part 2 of vitamin D. The reference video is on YouTube entitled Vitamin D and the Upper Respiratory Tract.